6:31 now. It's been a little more than 2 months since the 15-week abortion ban took effect here in Florida. Now women's health providers tell us they're seeing a significant spike in demand for contraception.
ABC Action News in-depth reporter Stassi Olmos asked around and found that reproductive appointments for men and women harder to get. Some taking so long, patients are leaving the state to get the procedure.
On June 24, 2022, the U.S. Supreme Court overturned Roe v. Wade, revoking the constitutional right to an abortion and allowing each state to make its own abortion laws. Within 10 days, Florida enacted a ban on abortions after 15 weeks and 6 days.
Right away, we saw an increase in the number of calls that we were getting, to our health centers.
In the past 2 months, Planned Parenthood of Southwest and Central Florida tells me they've seen a significant increase in patients seeking contraceptives.
We're definitely seeing more patients request appointments for contraception, particularly, long-acting contraceptives, people seeking appointments for vasectomy, for tubal ligation, so permanent sterilization.
Within 24 hours of the Supreme Court decision, women's telemedicine company Wisp saw a 3,000% surge in demand for its emergency contraception, which is also referred to as a morning after pill or pill form abortion. As of September, Wisp tells me daily sales are up 10% now since the court ruling. Florida's law also requires a patient to have 2 appointments at least 24 hours apart in order to get the procedure, which has pushed appointments weeks out.
The wait times, unfortunately, for appointments continued to get longer because, when they added the 24-hour waiting period, that meant more visits to the health centers.
The Tampa Bay Abortion Fund tells me demand for their help was a much slower onset.
We're just now kind of starting to see our calls pick up, both from people who are needing to leave the state because they're at that 15-week point and they can no longer access abortion in Florida, and from people who are coming into Florida to access care, in the Tampa Bay area.
A look at this map from the Center for Reproductive Rights shows that Florida is the only southern state from North Carolina to Texas that even allows an abortion after 6 weeks.
Pretty much every other southern state either bans abortion outright or bans abortion around the 6-week point, which at that point, most people don't even realize they're pregnant.
Planned Parenthood says out-of-state patients are also contributing to high demand in clinics, and for some, it's too late by time they can be seen.
Sometimes patients don't realize how far along they are. And then if they have to wait a week or two for an appointment, that can put, them beyond, the limit of care here in Florida. So I've already seen patients where that has happened.
Both Planned Parenthood and the Tampa Bay Abortion Fund are ramping up programs to help women travel further north or west if needed.
Paying for plane tickets, not originally in our budget. So we are building a separate budget, a separate fund specifically for that travel.
With donations collected since the Supreme Court decision, the Tampa Bay Abortion Fund expanded from Hillsborough and Pinellas counties into Lakeland and Sarasota, but say they are aiding anyone in the Tampa Bay area that they can. I'm in-depth reporter Stassi Olmos, ABC Action News.
Planned Parenthood, along with several clinics and activist groups, have filed a lawsuit against the ban. They're also appealing a temporary stay order to stop the ban while the lawsuit is pending. In addition, clergy members from 5 religions have also sued the state, saying the ban violates freedom of speech and religion, specifically clergy members' ability to counsel people about abortion, since Florida law prohibits counseling a crime.